Leslie, even as the COVID rates are up and down in the community, before a big operation, I'm still offering my patients the chance to come into hospital to meet me, and I like them doing that. I like establishing a relationship. Is that still a reasonable thing for me to offer? Or
Absolutely. Yeah,
Yeah,
absolutely.
yeah.
I think when the decision to have my colon removed, I needed to sit with someone face to face because it was such a big decision. I'd had other major surgeries in the past, but this was the biggest surgical decision I'd ever made. And it was so important for me to be able to have trust and confidence and to build up a rapport with the surgeon, albeit for a short period of time. But I felt that was very important. And also it was very important that my family could also sit, because when you are being told about surgical procedures, you're often quite stressed and not taking it in. So to have other people around asking the questions that you may not be picking up and indeed not listening to is really important. So yes, wherever possible, I think seeing you face to face is very important indeed.
And Carrie, before a big operation, it's the same question. Before a big operation, I like to bring patients in at least once to see me, even with the COVID rates up and down. From your point of view, do you think that's still a reasonable thing? And should patients still take that opportunity if they want it?
I think if you're having a major operation, to have that opportunity offered to you, it is excellent. You know, I would have wanted that. If I was about to embark on the journey that, you know, I had a couple of years ago, it's just so major, and you need that face-to-face reassurance. And also sometimes as well, you know, you then need to go elsewhere in the hospital if appropriate to see X person, get some information to do some, you know, as part of that that first consultation. So there are some practicalities there as well. So if I been offered that opportunity, I would have weighed up, like Neil said earlier on, about the risks of visiting the hospital versus the risks of, you know, what we're facing within COVID. I'd be looking for that reassurance and that feeling of safety that the hospital would be providing for me.